Dr. Robert Strang, Chief Medical Officer of Health, here again. Today we're announcing 17 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 90. Where the investigations are complete, we can say that these are related to travel or connection to earlier cases. We have a few that the case investigation is still ongoing, and it's not clear where the source of exposure may have been. It remains too early to say if these may have been from community spread within Nova Scotia. None of the new cases are connected to the St. Patrick's Day gathering in Lake Echo that was announced yesterday. All of the attendees at that event have been contacted by local public health, are being tested, and the results are pending. We know that of our 90 cases, they include people between under the age of 10 all the way up into people in their mid-70s. 2 of the individuals currently being tested are in hospital, and I'm pleased to be able to report that 3 of our earlier cases can now be considered to have recovered from COVID-19. Along with the 90 positive tests, we have had 3,649 Nova Scotians who have been tested and are negative. Earlier today, Nova Scotia Health Authority Public Health issued a notification about possible exposures at a business in New Glasgow on March the 11th and a hockey tournament in Antigonish on March the 12th. It's important to understand that anybody identified as a close contact of the cases involved in both of these events has been identified and tested. Regional Public Health is taking the extra precaution of issuing this public announcement simply to try to identify if there are any additional potential contacts. But again, anybody as a known close contact would have already have heard from public health. Today's numbers continue to climb, and some people may see that as concerning, but I actually see that as an indication that what we're doing is working. We have asked people to, returning travelers, when there was the virus, our greatest concern was the virus being brought into the province. We put restrictions on travelers first outside of the country and then outside of Nova Scotia, requiring them to self-isolate. By and large, people are doing that. We've set up mechanisms for online assessment and then telehealth assessment, and then ways for people to get in to be tested very promptly with appropriate infection control, and then follow up by public health on any cases as well as their contacts. If anybody's a positive, to put a tight circle around that case. All that is working. The fact that in the vast majority of our cases, they've had very small numbers of contacts shows that. We also know that we are continuing to expand testing, and as we expand testing, looking for a more indication of potential spread within Nova Scotia, we will see more positives. The more people we test, the more positive tests we will get. That's just a reality. So people need to be, expect to see some more tests continue to be positive into next week. I said to folks yesterday that we have expanded testing by all of our contacts of cases are now being tested right away. Anybody who has to go to hospital with significant illness from respiratory disease is being tested. Anybody now who is screened in by telehealth, 811 telehealth, all of those individuals will automatically be tested when they go to an assessment center. And starting today, Nova Scotia Health Authority has implemented an occupational health line. Any healthcare workers who are employed by Nova Scotia Health Authority, by the IWK, or a home care or long-term care facility agency, if they have symptoms of fever or new cough, and they call in that occupational health line, we will test them regardless of whether they've traveled or not. This is good news in 2 ways. We are make sure that by testing all healthcare workers with respiratory symptoms, we are taking an extra step to prevent the introduction of COVID-19 into any of our healthcare facilities. But it will also give us a good handle on possible spread within communities by, healthcare workers live out in our communities, and testing them will help indicate whether we have community spread. We do know these are challenging times for folks, and that the fear of the virus is real. The necessary public health measures are causing significant disruption in our day-to-day lives. I've been encouraged by the way Nova Scotians have responded with caring, community building, and common sense. By working together to keep each other safe and to support those who may need our help, that is how we're going to minimize the impact of COVID-19. So I want to thank Nova Scotians for that. Unfortunately, there's been a few stories that I've been made aware of people, whether they've been identified as a known case or a contact of a case, that are being harassed within their community and also online. That is not helpful. That is inappropriate. Now is the time when these people would need extra love and support from their community. So I'm asking all of us to be kind to each other, to be caring, to be there for each other, and to be a friend. We all need to be at our best during this significant challenge. We are 3 weeks in. I know lots of people are getting tired, and I certainly am, but we have a long road ahead. We're in this for a number of weeks, and we need to be committed to that. We all need to continue to work together, to practice good hygiene, using physical distancing, but also using the technology we have available these days to stay connected. By staying committed to this, we will keep each other safe, especially those who are most vulnerable for severe illness, and then our healthcare workers who are putting themselves on the front line every day to care for people with COVID-19. This is how we'll decrease the impact of this disease in our province, and it will also allow us to return to normal as quickly as possible. I want to thank the many Nova Scotians that have been sending messages of support and encouragement to the Premier and myself, to my public health team, as well as the hundreds of workers across the healthcare system. I get the privilege of being the public face of this event, but I'm here just representing those many hundreds of workers across the healthcare system who are working very hard 7 days a week to put things in place to make sure all of Nova Scotians can be safe. I also want to thank and recognize that there's many other regulated health professions, such as dentists, that have willingly shifted their work. So we've asked them to continue their regular work only when they can do that through virtual care, but they've also been willing to stay open to see people in person when there's urgent or emergency issues. So we thank them for that. I'll end by repeating, and it does sound like a bit of a broken record, but it's a very important message that I'll continue to say. We need to wash our hands. We need to stay at home. We need to help each other, especially those who are least able to help themselves. By doing that, by staying focused on each other, by staying positive, that is how we'll get through this significant issue.